Hello, everyone. Dr. Tony Scuderi here uh, in the ethics course. This presentation is going to be on the Tarasoff case. Now, this is a very important case. A lot of times, ethics courses spend a good bit of time on this because of the importance of it. I will give you a PowerPoint presentation on this, but also give you some information after the PowerPoint presentation on how I was involved with the Tarasoff case, and in fact, in Pennsylvania, because of the case that I was involved in, Pennsylvania now has a Tarasoff law, which at one point it did not. So, without further ado, let's share the screen and let's go to the Tarasoff case. All right. So, this is the case of 1969. So, in this presentation, you'll see how the case was derived. We'll talk about the case in brief because it can be a bit lengthy. We'll talk about the role of psychotherapy and the psychotherapist. October 27th, 1969 is when the incident occurred, and the ruling was in 1974, the court ruling. So you can see it does take time in the courts to get through this. And then we'll have a summary, final outcome, review the case all over again. And then I will give you my um, my situation, what happened. Also attached to this is going to be what they call an amicus brief. An amicus brief is a legal document that lawyers put together to present to the court. In brief, the case that I had went all the way up to the Supreme Court of Pennsylvania, and it took several years to go through. Needless to say, it was a very trying time in my life and my career. Fortunately, I did everything correctly. That's why I'm presenting it to you. The amicus brief is basically what the case was about and the court's decision. I want to say this now, and I'll say this again when we get to the explanation of my case. I was a bit disappointed because somehow the attorneys, I was not called into court, but the attorneys did not present all the evidence. Some of my notes were not presented, which caused one of I think it was 9 judges of the Supreme Court to dissent. I was very upset at that, and I contacted the attorneys afterwards and asked them what happened. And we'll talk about that later. All right. So let's start with the Tarasoff case. This was a case of the Regents of Tarasoff versus the Regents of the University of California. This case happened. It was a Supreme Court case. It started in the lower courts and eventually went up to the higher courts. It established what's known as the duty of psychotherapists to warn a third party when they believe their client possesses an imminent threat. Listen to this very carefully, okay? The case has remained controversial since its ruling in 1976. Therapists must brief confidentiality to warn potential victims, but it has not significantly altered psychotherapy, as some believe it would. In fact, the ruling was extended in 2005. That's called the Tarasoff 2 case. So Tarasoff 1 was decided in 76. In 2005, Tarasoff 2 came into play, which includes threats passed on to psychotherapists by family members of the person in treatment. Let me spend a little bit of time on that, okay? First of all, the first case, Tarasoff 1. Um, as you know, we as therapists, and even though this says psychotherapists, it got extended to all mental health professionals. And though we are not licensed as psychotherapists, we are mental health professionals, even as substance abuse counselors. The thing I want to say about this is you still have to check the state statutes if you're not going to be in California, because some states still do not have a Tarasoff law attached to it, believe it or not. It's supposed to be over all the 50 contiguous United States, as well as Hawaii and Alaska. But from the research that I've seen recently, there are still a couple states. I don't remember their names, but a couple of them still don't. But this is one of the few cases where you can breach confidentiality and not get sued for it. Okay. And we'll see how that works. And I think the key phrase here is right here, an imminent threat, and what that means, and warn a third party. Um, so if somebody comes to you in therapy and sits there and says, I'm going to kill somebody, or I'm going to cause bodily harm to somebody, and you can't say anything because you're my therapist, you're my counselor. That's not true. You can, if you truly feel that this person is going to harm somebody, you need to document this. You need to get to your supervisor and tell them immediately. If possible, don't let that person go, and then call the authorities. Again, I don't want you to start acting on this on your own, because sometimes people will get in the heat of the moment, sit there and say, I wish I could kill the son of a bitch, right? Um, and what happens is they're really not going to do it. They're just a little bit angry. So you got to make a judgment call. Then there's other times when somebody will sit there and say, I want to kill the son of a bitch, and they will do it. Okay. So uh, I would always do consultation on this if you ever run into a situation. Because if you don't, you are liable, and you can be prosecuted under criminal charges with this and be sued. This is one reason why, as I said before, there are three things that you need as a therapist: a good liability insurance policy, a good psychotherapist for yourself, right, and supervision. Those three things. Those three things. Liability insurance, just in case something happens, and hopefully you'll never have to use it. A good shrink, a good therapist for yourself. And I'm talking psychotherapist. I'm talking somebody that's probably a psychologist. Um, Stay away from marriage and family therapist. Stay away from a social worker. Certainly stay away from another substance abuse. I would say go to a psychologist, because they're more trained in dealing with little issues. Social workers are okay if you can't get a psychologist, but they're more social worky stuff. I don't care if they're clinical social workers or not. I know my training, and I know the training of a social worker. It's a little bit more. Not saying anything bad about social work. They've got their place, as do marriage and family therapists. But when it comes to this, I would strongly urge you to go see a psychologist or a psychiatrist. Now, what do I mean by that? No, you're not crazy. No, you probably don't have a psychopathology that you have to deal with, but maybe you do. You are going to deal with patients that have very complex problems, from complex traumas all the way down to using and relapsing. And you're going to be triggered. There's going to be things in you that are going to be triggered by what the patient says. This is part of the normal process. And if you are triggered by what the patient says, then I would suggest that you go get that taken care of. That's going to be transference and countertransference. Right? This is where I say that the psychologist comes in most handy, because we spend a lot of time in our training, in our academics, in transference and countertransference. Social workers and MFTs do as well, but I don't think they go in as much detail as we do. But regardless of the situation, you make your choice. If you feel more comfortable with a social worker, more comfortable with an MFT, God bless you. Just so long as you get yourself taken. Don't have to sit there and go every week. Just call the person up and sit there and say, I'd like to see you. I'm seeing patients. I'm a drug and alcohol counselor. I'm dealing with patients that have, dual diagnosed issues. And I just want to do a tune up every once in a while because I need to unload what I'm doing, so I don't go crazy. That's very healthy. Yes, supervision is a good thing, but supervision isn't psychotherapy. The job of supervision is for your supervisor to take a look at your charts, see how you're doing, make sure you're in compliance. Are there any issues with any patients? Not with you, with the patients. What are they? To deal with them and to move on. Your issues are different. Your issues of reliving traumas from the past, being triggered by what the patient says, maybe dealing with some depression, some anxiety, sleepless nights, maybe your own addiction. That is taken outside of the workplace. This is why I say you need a psychotherapist whenever you're treating patients. When I treat patients, I call my insurance company and say, I'd like a psychotherapist. I'd like a psychologist. Can I have a listing, please? And I tell them exactly what I need. I get one. call them up and sit there and say, "Hey, how you doing? This is Dr. Tony Scuderi. I do drug and alcohol treatment, and I got people with co-occurring disorders and correctional issues. I'm pretty much fine right now, but I'd like to see you for a tune-up every once in a while because I've got a lot of very difficult patients and no one to talk to. I'm usually going to yes, sit down, meet the person. If I like them, I'll see them, give them a call as needed, and dump my stuff on that individual. Sometimes I'm used. Sometimes I get phone calls from therapists. Hey doc, can I see you? Sure, come on down. And we help one another. Very healthy, and I would strongly urge that with you, especially with cases like this. All right, so here's the case. The person, Prosenjit Potter, a University of California graduate student. He was a student there, obviously, and like most college students, college is a very good place to meet people. Well, he happened to meet this one person. Her name was Tatiana Tarasoff. She was a woman that he met in a dance class, and the two of them briefly dated. But afterwards, Tarasoff rejected him in favor of other men. They went to a dance together, and he was serious, and she was his girlfriend. When he tried to pursue her further, she said, "No, I want to see other people." He felt very rejected with that. He became extremely depressed, and then started stalking Tarasoff. So he sought treatment eventually by this doctor at the University of California, a Lawrence Moore. Lawrence Moore was a psychologist at Berkeley, and he was in the Cal Memorial Hospital attached to Berkeley, right? So they had brief sessions, approximately, I think, 7, 8 sessions, something like that. In the final sessions, Potter told Moore that he intended to kill Tarasoff. Now, this is towards the end of the session. You may get this every once in a while, where all of a sudden things are going fine. Then around the last session, when you're starting to wind down, your patients will sit there and say, "Oh, by the way, I have one other thing that's bothering me," and then dump something. Well, what do you do with that? Well, if you accept insurances, I would certainly call the insurance company and say, "We need to extend these sessions." Right? Also, discuss this with your supervisor in all cases. Do not act independently. If you act independently, that can get you in a lot of hot water. Also, document, document, document. Write down exactly what happened. Use quotation marks. Use times. This therapist at 10:45 had a session with John Doe, who stated that he wanted to hurt somebody. This therapist contacted supervisor, discussed with supervisor the possibility of 5115 patient, et cetera, et cetera, et cetera. Document very clearly in case something. So in this case, Potter went and told Dr. Moore that he intended to kill Tatiana Tarasoff. So let me stop there. What's the role of psychotherapy? Well, Dr. Moore diagnosed him at that time with acute paranoid schizophrenic reaction. Okay, notified campus police and suggested that Potter be placed under observation in a psychiatric hospital. Smart move, right? So the police came, they detained him, but unfortunately, the police released him after they interviewed him and talked to him, and he said that he was going to stay away from Tarasoff. Dr. Moore's supervisor ordered him not to request any further detention of Potter. So Dr. Moore was under supervision with the psychiatrist. The psychiatrist sat there and says, "Nope, don't detain him." The cops took him. The cops interviewed him. He said he wasn't going to do it. Let it go. So neither Dr. Moore nor the doctor examined Potter, who examined Potter, warned Tarasoff or her family about the threats against her. And herein lies the issue. At that point, back in '69, when this occurred, there was no law in place, right? So here's this guy in therapy that turns around and says, "I'm going to kill Tatiana Tarasoff." Psychologist does the right thing, gives a diagnosis, calls the police pick him up, and the police interview him and sit there, and this guy says, I'm not going to do a thing. This is very common. Patients sometimes, when, at least in my practices, patients that I've sent to the hospital that I believe are psychotic or whatever the case may be. Back then, they would walk into the ER, doctor would examine them, the person sits there and knows exactly what to say, and the doc says, "You're not crazy. I want to discharge you." And they discharge the person back to the street, and the next thing you know, there's a bigger psychotic break, and then the police come up days later, or something happens. All right, that does happen periodically. Um, the problem is after the police interviewed Prosenjan Potter, they should have called him back. The doctor should have called him back just to debrief him, and they didn't do that. All right. So Potter didn't return to therapy. Instead of returning to therapy, what does he do? He continues to stalk Tarasoff because he thinks that she's over there, and how dare her, thwart him. So he does it rather subtly, and he befriends her brother, believe it or not, because he really had no place to go. It was around summertime. He had no place to go. The brother knew him, and he says, "Hey, can I move in with you for a little bit?" So the brother says, "Sure." He knows nothing about what's going on, and they move in together. Now we come to around October 27th, 1969. Right? On this day, Potter goes and attacks Tatiana Tarasoff. First, he shoots her with a pellet gun, and then he stabs her to death. Very, very tragic. So, the upshot of this, her parents sued Dr. Moore, sued the university, arguing that they should have been warned of the threat. So, although the lower court dismissed the case on the grounds that the doctor's duty was to his or her client rather than any third party, the case was appealed. At that point, remember, you got the doctor-patient relationship, right? And confidentiality in the session. So the way that the judge looked at this was, Potter went and told the doctor something, I'm going to do this. The doctor followed through, took him to the hospital, sent him to the police, and because they had that relationship, the doctor-patient relationship, then the therapist had no duty to warn. Very important term here, folks. Duty to warn, right? Had no duty to warn the parents or anybody, any third party, that this guy was going to hurt them. Because at that point, the police interviewed him, if you remember, and released him and said he's not going to do anything. Psychiatrist of Dr. Moore, who was a supervisor, sat there and says, "Don't follow through with it." The police took care of it. He didn't follow through with it. Potter seemed fine for a while. Goes to the brother, rents a room or stays with his brother, however that worked out at that time, and then eventually still angry, still has this festering, probably racing thoughts about what's going on, fantasizing about what's happened. Starts with the attitude of, if I can't have her, nobody else can, and then starts to stalk her. In 1964, there was a court ruling on this. The Supreme Court ruled that mental health professionals, in fact, do have and here it comes, duty to warn. This is very, very, very important. So in 74, the Supreme Court ruled that you guys, we therapists, have a duty to warn. And notice it doesn't say psychologist. Notice the wording here is mental health professionals. You and I are mental health professionals. We have an inkling that somebody is going to do physical harm to somebody else. We have a duty to warn that person and a duty to warn the third party. We can get a hold of their family members. That happens, and that ruling was held up in 2005 in the Tarasoff. So there was strong dissent from Judge Clark. He argued, or Justice Clark, he argued that a duty to warn compromised the confidentiality of psychotherapy, and the clients might not seek treatment if they knew that their stories might be shared with third parties. This is true. We as therapists and counselors, have this code that we must follow. It talks about confidentiality of a patient. It's known in the field as client-doctor confidentiality. Whatever a client says to us is kept in strict confidence. We can't disclose that to anyone, right? Even when you learn about HIPAA and FERPA and 42 CFR Part 3, Part 2, Part 8, it sits there and has very um, uh, poignant points, very, very strong points on what is confidential and not, and how to release confidential elements to things like insurance companies. All identifying information has to be removed to protect the client. But here, Justice Clark turns around and says, no, you know, if he goes and tells anybody, any third party, that's a breach. Think of it yourself. What if you were to come to me for counseling, for therapy, right? You tell me something. You stole $150 from your mother, and that's all she had for food for the week. And so they're going, how could you do that? You know, and then I call your mother up on the phone and sit there and say, hey, you want to know something? I remember that $150 that was missing. Well, I was just told by your son John that he took it. Well, you go do what you want to do. Really? You can't do that. So there was an issue there. Um, so that was that part of the case. So the justices at that point had the duty to warn. You can look at this on this blog page over here that I have, um, and you could read the whole case. So summary of the Tarasoff case involved a murder victim. The murder victim was Tatiana Tarasoff. She was killed by her acquaintance, Progenitient Potter. Potter was a client of Dr. Lawrence Moore, who was a psychologist. He was employed by the University of California. He had stated during a therapy session that he intended to kill Tarasoff because she had rejected him as his lover. So he was assessed as a danger, was held briefly, and was released. Shortly thereafter, his temporary confinement, he did indeed kill Tarasoff, started with a pellet gun and then killed her. Victim's parents sued the therapist, the campus police, and everyone who had contact with the case at the University of California, which included the Board of Regents. Okay? And they were sued for wrongful death. They asserted that if the therapist knew that Potter was indeed a danger and there was intent related to this threat to his victim, that they had the duty to warn her. Um, you can find that whole case right over here. Feel free to copy this, paste it, and review the case yourself. They did, by the way, win the case. Majority decision, the court found that the protective privilege ends where the public peril begins, right? The protective privilege between client and therapist stops when the public peril begins, right? So the decision had a significant impact on the legal requirements for a clinician and certainly affected the client's confidentiality. So now when clients go into therapy, psychotherapy, addictions counseling, any type of therapy, you have to tell them this, right? If during the course of therapy, a clinician feels that a client's a danger to someone, that therapist has a duty and is compelled legally. In other words, you are on record. You have to warn not only the intended victim, but you can also turn around and if there's people involved in this, like, if you can't get the victim, you have a duty to warn a third party. You could tell their parents or their grandparents or whoever their guardians are, that this is happening. That part came up in Tarasoff 2. Again, Tarasoff 1 was just a duty to warn the intended victim. Tarasoff 2 added to that you also can warn family members. So the final outcome, the duty to warn, and also the thing called duty to protect, right? The duty to warn the intended victim and the duty to protect society came out of the Tarasoff case in mental health. Confidentiality and the duty to warn was mainly there to protect the potential victim, not you, the victim. And you cannot get sued if you can prove that it was a duty to warn case, if it was a Tarasoff case. This is why I will say it 1,000 times in all of my lectures to you: document, document, document. Be clear in your documentation, be precise in your documentation, time, date, place, person, all that stuff in there. Make sure it's clear, make sure it's precise, make sure that it says exactly what went on in the session. Use quotation marks, right? That will protect you. If it isn't written, it never happened. And if you have to appear in court and you could tell the court all you want, hey, but I documented it and it's not there, that's going to be an issue for you. Even if it is there, as in what happened with my case, the documentation was there, but the attorney never brought it up. I'm still trying to figure out so many years later why that happened, because I never got an answer from the attorneys. Let's get that in another case. All right. So ethic and legal implications are there for the therapeutic relationship. There are also ethical and legal imperatives for client confidentiality. In other words, what remains sacrosanct in confidentiality, and what can you tell somebody? Again, this is a judgment call. If you're a psychiatrist, you're going to have patients all the time that are going to sit there and with their psychosis acting out. They may sit there and say, I want to kill somebody here and there. Psychiatrist has to be very clear with this. Sometimes patients can say that, and it's in the heat of the moment, and they're not going to do anything. And then again, the psychiatrist may sit there and have a question. This is the heat of the moment, and the next thing you know, they're uh, getting that person for observation in the hospital. You don't want to play with this. Again, I want to insist. If you ever get a patient like this that sits there and says, I'm going to hurt somebody or hurt myself, elder abuse, child abuse, hurting oneself, hurting somebody else, any of those cases, right? You've got a duty to warn. You have a duty to warn. Go to your supervisor first. If at all possible. If your supervisor is not there, whoever is next in charge, and document what happened, and then make a decision. Okay? Let me stop here for 1 second because I want to talk about that making a decision. Sometimes that decision may cost you a job. Let me tell you why. Not that you did something wrong, but you did something right. Your supervisor may tell you not to call the police, not to get this person, in the hospital. And if that occurs and you don't do it and something happens, you're going to be sweating for a little bit. It may or may not work out for you. Okay. But if you sit there and you say, I have to do it, my conscience is telling me that this person is going to hurt somebody, I'm going to call the police. You call the police come down to the clinic. What's going on? The police have a duty at that point to get a hold of you and the patient, take that patient out. Well, the boss can sit there and say, what did you do? You just broke confidentiality. You're fired. Get out of here. Pack your stuff and get out of here. Well, don't argue. Pack your stuff and get out of there and call your insurance company and sit there and say, this is what happened. All right. The next thing you want to do is you want to call labor relations, because that can also be an illegal termination. But you talk to your attorneys first from your insurance company. This is why you have to have liability insurance. If you don't, you get fired. They're not going to cover you, right? And then the family is going to come after, if he's released and something happens, the family's going to come after you, and the family's going to come after the clinic. The clinic's going to sit there and say, we fired that person. They're no longer with us. They're not covered under our insurance policy. So they're going to tell their attorneys, take care of us. So the attorneys are going to take care of that company. They're not going to take care of you, right? There's a slight chance that you may, but chances are you won't. This is why you need to have your coverage. Please consider it. And it's not that expensive. All right, back into it. Failure to detain a dangerous patient. This is what happens in the Tarasoff case after the police released President Potter, after they released him. The psychologist, Dr. Moore, did not take him back, and he was still dangerous. Being that he was able to commit this crime, the failure to warn a dangerous patient that to Tatiana Tarasoff and their parents that hey, look, Potter has got this crazy delusion that you're his girlfriend, and he's very angry right now, and he's threatening to kill you. Because that did not happen, issues arose for the therapist. The issues were basically abandonment of a dangerous patient. So here we have, Potter coming into play now. They released him. So technically, because Potter was a dangerous patient, a danger to others, the therapist across the board, right, the supervising psychiatrist as well as the treating therapist had a duty to that patient to continue psychotherapy. They released him from psychotherapy still in danger. So now we have an issue with the psychotherapist. If treatment is over and the person commits a crime, are you liable? Well, you can be. Not necessarily you are, but you can be. And this is where, again, your malpractice insurance comes in and the attorneys fight it out. If you can justify the discharge and you can, without a reasonable doubt, sit there and say the patient did not was no longer a danger to society, to oneself or somebody else, maybe in favor of you. If you can't prove that, we have some issues. Then we have a breach of the primary duty of the therapist for public safety. Now, here's this guy that threatened to kill somebody. You let him go, and he kills somebody, right? So he kills Tatiana. Who says he's not going to kill somebody else? Just because he had the delusion that she was his girlfriend and something was going on there. I mean, he could have snapped. He could have killed her. Oh my gosh, I killed her. What am I going to do? If he was schizophrenic and heard voices, the voices could be telling him go kill somebody else because no witnesses. Somebody might have seen you. Right? We have a problem with society here. So let's take a look at the case. Right? Let's review this. So again, this is so very important. Tarasoff versus the Regents of the University of California. The case was October 27th, 1969. So Potter was a patient of Dr. Lawrence Moore, right? Moore was one of four defendants. You had the regents there, and I'm sure the psychiatrists there from the hospital, the university. So during one of the sessions, Potter informed Dr. Moore that he intended to kill Tatiana Tarasoff because he turned down his romantic advances. So Dr. Moore had the campus police take him away, and he was released shortly thereafter after the police questioned him. And then, as we know, he killed Tarasoff. Okay? This is what Trojan Potter looked like. Um, just to give you an idea, and this was Tatiana Tarasoff. So, a little background information: Tatiana and President Potter had met about a year earlier, so there was some type of relationship, and they were taking the folk dancing class together at the university. They went to a New Year's party together and gave each other a New Year's kiss. And at that point, Potter started to get thinking that, my gosh, this was a great kiss. She's really a cute girl. Um, we have a serious relationship. I mean, nobody kisses me like that without a serious relationship, right? Let's start going. Eventually, Tarasoff, Tatiana, told him that she was involved with other men and wasn't really interested in him. Sorry. Um, he felt thwarted, embarrassed, and this can also be a cultural thing, right? Because sometimes in cultures, when a man and a woman have that type of a, let's say, long-term relationship, at least a year, and then kiss one another now and then, sometimes in the culture they may see that as a commitment. If they don't see it as commitment, that's okay too. So Potter became a bit depressed. He started neglecting his studies. Depression continued. Then he started talking to a friend about, crazy stuff blowing up her room and all this. So a friend was involved. Potter's friend was involved. He eventually was convinced by his friend to go to the health center of the university and go see somebody, go talk to somebody about it. So he went to Cal Memorial Hospital in California, and the doctors diagnosed him as a paranoid schizophrenic. He was having this reaction. It was acute and it was severe. So as time went on, October of '69, um, Potter stalked Tatiana. And of course, we know that he was staying probably with her brother for a while. He found her, stalked her, shot her with a pellet gun, and knifed her. As time went on, her parents contended that only a short time before that, Potter had expressed his intent to kill her. And in fact, he did. And this is what they brought up in the court. So they alleged that he had confided to his therapist, Dr. Lawrence Moore, a psychologist who was employed by the university. And this is where the regions come in because this was part of the university. So they further alleged that Dr. Moore had warned campus police of Potter's intention, and the police really didn't do anything. They detained him briefly, but then they released him. So did the defendant or the plaintiffs owe a duty to the victim? Did they owe some type of a duty to Tatiana Tarasoff? If they did owe a duty to her to tell her something. Now remember, this was before they made the decision for the duty to warn. And the parents are arguing, in court that they should have, Dr. Moore and all involved should have warned the parents, or at least tried to get a hold of them, that something was going to happen to Tatiana. Were they liable for the harm? Well, their defense, they owed no duty of care to the victim. The doctors and the police said that they owe no duty to care. There's nothing in the books that sat there that they did. They had confidentiality involved. If they did that, they would have breached confidentiality, which means their license was on, and they could get sued. I mean, it really got messy. So the defense was saying they owed nothing. Um, the plaintiffs, Tatiana's parents, turned around and they sat there and they said in their defense that they should have contained him. Even, and don't give me the bit that they contained him for a little bit, because he was still unstable. And even though he said that they didn't, he should have got, they should have referred him back to the psychologist. The police should have referred him back to the psychologist for reexamination. And then at that point, release him. Well, they already examined him. They found him, he was a little bit paranoid schizophrenic, but it was probably reactive to it, to what was going on. And the police said there's no problem. So he's probably calm, professionals to professionals on go. The parents said, no, you didn't properly warn us. And you didn't warn Tatiana. You didn't warn us. You didn't warn anybody about the threat. We knew nothing of this. If we would have known that this guy was threatening our daughter, we would have done something. I mean, this is the defense case. So, um, did the plaintiffs owe a duty to the victim, to Tatiana, in making them liable for their harm? And we saw both of the arguments. Defense said they had no duty to warn because of patient confidentiality. The parents, on the other hand, said, of course you did, because somebody threatened our daughter. So this gets tossed to the Supreme Court. And the ruling was in the Supreme Court that they heard the case twice, once in 1974 and once again in 76. Right? The 74 case, they said, well, yeah, there is a duty to warn. And then they fought it again. And in 76, but we're not going to hold it. So the court found the police could be held liable in the first hearing. So the first hearing, the courts found the police can be held liable, but not in the second. Second hearing, they found the police could not be held liable. The conclusion of this was that the police did not have the requisite special relationship with Tarasoff sufficient to impose a duty to warn her or Potter's intention. So in the first case, they brought everything. They brought charges against school, against Moore, against the Board of Regents, against the police, against everything. In the 1974 case, they said guilty. They appealed it in 76. In 1976, it went back to the Supreme Court, and the Supreme Court said, well, special relationship of the patient was with the psychotherapist and the supervisor. The police really didn't have a special relationship with Tatiana Tarasoff, at least not one to impose a duty to warn on her. All their job was to turn around and to um, detain him for a short period of time, and that was it. So Potter was subsequently convicted of a second-degree murder, but a conviction was later appealed, right? And it was overturned on the grounds that the jury was inadequately instructed. That was in 74. Second trial was held, and Potter was released on the condition that he would return to India. And that's what happened. So the second trial, they kicked him out of the country, never went to jail, right? And he got sent back to India and was deported for the murder. Tragic case. It's a tragic case. So here we see somebody that actually had the intention to kill, actually had the means, the motive, the opportunity to kill, had a mental illness, was tried, was found guilty not of premeditated murder, murder one, but of murder three. The family sat there and said, this isn't right. They should have informed us, or they should have informed Tatiana and all of us. They sued the school. They won the lawsuit from the school. They won the suit case, tons of money. The Supreme Court then sat around and said, no, get out of here, get out of the country. So they deported Potter. He's back in India. It is on the books. He cannot come back to the country. Until this very day, in states like California, it is mandated that you, as a therapist, have a duty to warn. All right. Let me stop there because that's the basic case. Let me briefly go into what happened. Back in the 90s, early 90s, I was just starting out. I had left the priesthood about 1992. But I was leaving before that time, so I had to find a job, and I had my degrees in psychotherapy. So in Pennsylvania, you can treat patients with a master's degree, so long as you're supervised. And I was. And I was at this clinic. It was called the Philadelphia Center for Human Development. I was a psychotherapist there, and also the clinical coordinator for the whole program. We had a dual diagnosis program. Drug and alcohol was not in effect at the time. Everybody was grouped together because we were dealing with the chronic population. I and another colleague decided, hey, some of these diagnoses are substance abuse related. Why don't we have a substance abuse program? And we started one. So as time went on, there was this couple, and the couple that we had, her name, and we could disclose this at this point because it is public record at this stage. Her name was Teresa Hausler. His name, the boyfriend, was Gad Joseph. Okay, Gad was a Vietnam veteran, and Teresa was his girlfriend. They were both drug addicts. Initially, the clinical director was treating both of them. She decided it was a conflict of interest to treat both of them because something was happening with Teresa, and Gad was a bit difficult and had some women issues, if you will. So she asked me, because I was one of the leading therapists in the clinic, she asked me if I wouldn't mind taking one or the other. So she would either treat him or I would treat him or vice versa. So I said, well, why don't I treat Gad and why don't you treat Teresa? She agreed to it. So we did the paperwork and we had a nice transition over, which basically was Teresa, Gad, me, and her, the clinical director, whose name shall be left out of this. So during the transition period, we had a session together, and I was introduced to Gad, and I was introduced to Teresa, and we discussed in that session the reason why we think it'd be a good idea for them to be split up in sections and for Teresa to see uh, her and for me to see Gad, and they agreed. So as therapy went on, Gad was a very difficult patient. It was almost like every week I would see him. It would be my session, in with the psychiatrist. My session, in with the he was diagnosed with schizoaffective disorder, PTSD, post-traumatic stress disorder, and that was just coming out, by the way, back then. It was not as common as it is now as a diagnosis, right? It was only seen as happening with people that were in the war. And before PTSD, that was called shell shock. So this was found in World War II when vets were coming back and they were having these same symptoms that we see PTSD, the dissociative symptoms and anxiety and depressive symptoms. So we saw this happening, and he was diagnosed with PTSD, schizoaffective disorder, and drug addiction. He was doing heroin, cocaine, marijuana, alcohol, pills. So here he is in session. And Teresa was doing heroin at the time, had a depressive disorder, and was also doing some alcohol. So the clinical director and I would be discussing the cases with each other. We had releases of information. We were able to do this. We were discussing the cases, and I was seeing some beautiful work being done on her part with Teresa. I was doing some very hard work with Gad. He was waxing and waning. And I kept getting consultation from my supervisor, from the psychiatrist, and eventually Gad started to clear up. And I started to see some really good improvement. The relationship started to get better between Teresa and Gad because they were living together. So then somewhere along the line, I'm not really sure where, somewhere along the line, um, Gad started dope fading, as we used to call it. And he would come into session. I'm not using, everything is fine. I'm looking for a job, et cetera, et cetera, et cetera. And he was looking good, but a little disheveled. I mean, with dirty jeans, shirt was kind of unkept, had long hair, that down to here, literally. Um, kind of not washed. Okay? And I started saying, "Are you using? You know, it looks like you're using to me, and it sounds it. Pupils were not where they should be." And I told him that, your pupils seem to be a little bit dilated and the lights are on, so they should be a little bit constricted. No, no, I'm not using. I swear to God, I'm not using. I haven't touched anything. So you can only go on what the patient says. So I challenged that and he insisted. And I says, all right, I'm going to let this go. Document. Went to the clinical director who was treating Teresa. And I said, how's Teresa doing? Teresa was doing fine. Stopped using heroin. She started looking really good, very well kept. She came in looking gorgeous, combed hair, moderate makeup, you know, looking like somebody that was starting to really like herself better. Depression was lifting, smiling a lot, affect improvement. Everyone, good job. Went to the psychiatrist, talked to the psychiatrist. I says, you think psychiatrist said, I think she's doing great. She's doing marvelous. I'm titrating her off her medications, going to meetings. She's got a sponsor. She's doing everything she should be. I got a problem with GAD. And I discussed this situation with the psychiatrist. He says, I want to see him. I said, all right. That's the situation with the clinical director. She says, okay, make sure that the psychiatrist sees him. I'm documenting everything. Psychiatrist sees him, right on target with me. He looks at me and goes, Tony, what do you think? And I says, I think he's using. Psychiatrist says, you're right on target. He is using. What else are you saying? And I told him, I says, oh, he looks like he's decompensating. As I think he's getting delusional. I think his voices are there, and he's guarded. Affect has changed. It's become more depressed. I remember these discussions like they were yesterday. And he looked at me and he goes, you're absolutely right. This is exactly what's happening. I increased his medication. This is what I'm giving him. So he increased the meds. I saw a little bit of stabilization, but not good enough. So as time went on, and I'm documenting all this stuff, as time went on, Teresa asks her therapist if she can see me just for 1 or 2 sessions. So the clinical director comes to me and says, Teresa wants to see you. Would you mind? And I says, well, I don't mind if you don't mind. She's your patient. He goes, no, but it's going to be an off day when you're not seeing Dad. I said, sure. So she comes in, and the first session, I had 2 sessions with her. The first session was, I want to thank you very much for all the work that you've done with me when in group, her in group, and both in group. And also the way that you've been working with Dad, you're really helping him to a point, and I want to thank you for that. And flag went up. I said, to a point. She goes, yeah. He goes, I don't know if you know it or not, but he's using again. I suspected it. She goes, yeah, he's using again. He's doing cocaine and he's doing alcohol again, and I think he's doing other things. He's doing heroin again. And I said, okay, be careful. Right. So we left. Back for the second section. I didn't tell Gad we had a session because that was confidential. She comes back for a second session, and I says, well, anything better? She says, no, it's getting worse. She says, but I want to thank you again because I want to tell you something. I said, sure, go ahead. She goes, I'm leaving him. What do you think? And I says, well, it doesn't matter what I think, but what you feel. Do you feel that this is the right move to make? If it is, I support you in that move. And she felt it was. And I said, where are you going? And she says, well, I'm going to go back home to my parents in Reading, Pennsylvania, which is really close to the center of the state, which was way far from Pennsylvania. Now, the history with her is her parents were abusive, and going back to that abusive environment. We talked about that a little bit, but she guaranteed me that her father had changed, et cetera, et cetera. And I said, well, you got to get out of the environment, do it. Dad comes to me, the following week, angry, and I says, "What's up?" He goes, "She's going to leave me." He goes, "Yeah, Teresa is going to leave me. She's going to go back." She says she doesn't want to be involved with me anymore. She doesn't love me anymore, and she's leaving me. She can't leave me. And I says, "What do you mean she can't? No, she can't leave me. We've been together for a while. We made love and this and that and the other thing. Everything's going on. She can't leave me. I can't have her. Nobody can." I said, "What does that mean?" Because if she leaves me, I'm going to kill her. So at that point, I sat there and I went into mode. I just immediately the Tarasoff case popped in my head. This guy is crazy, and yes, this is what's going to happen. So I says, okay. I says, I want to take a deep breath for a while and just sit back. So I said, wait here just for a second, okay? I'm going to have somebody in here just for one moment. I've got to go to the restroom. Don't go anywhere. All right. And he promised he wouldn't. And I had another therapist come in and sit just for a while. And I told him, I said, do not interact with this person. No questions, no nothing. Talk about a football game or something. It's okay. So he didn't interact with them, but he did have a session with them and said, continue the session I had with him without therapy, and just literally talked about the football game. So at that point, what happened is I went to my boss and I went to the clinical director and I says, we have a problem. As I think that Gad is going to stalk and kill Teresa. And they said, why do you say that? And I says, because he just told me in session that if he can't have her, nobody else will. And the boss sat there and says, well, what does that matter? So what do you mean, what does that matter? I said, haven't you ever heard of Tarasoff? I says, we got to call the police, because you can't call the police. I said, why? Well, first of all, Pennsylvania, you don't have to, we don't have that duty to warn. We don't have to tell anybody anything, and it's confidential. And besides, does he have a gun? He's got a gun at home. Did he bring it here? No. He goes, well, then he's just talking. And I says, what do you mean he's just talking? I says, he knows he's got a gun. He's violent. We know he's violent. This is what's going to happen. And the boss said, no, you can't do it. And I looked at the clinical director and said, what are you going to do? She says, well, I'm just going to talk to Teresa and her just stay there. That way nothing happens. My hands are tied and I can't do anything. So at that point, and I says, okay. So I went back to the session, says, Dad, you can't kill Teresa. I'm going to put you in hospital. This is just, I want you to calm down. And he says, no, you're not going to put me back in the hospital. I says, I'm going to call the police and they're going to take you in. He goes, no, you're not. And then he started, elevating his voice. He tried to come to the door and I says, I'll take care of this. Leave me alone. So I just asked him to sit down and he sat down. We talked a little bit more. So Teresa leaves. Gad comes back and continues to see me in sessions, and his sessions are up and down. And he finally admits that he's using. So he went to a hospital for a detox. Came out of the detox all clean and sober, looked fine. He's away. And then one day I get a phone call. And the phone call, Gad comes in my office and says, I got come on in. And he says, Teresa's clothes are still in my house. She's got to come back. Okay. She can't come back. If she comes back, I'm going to kill her. And I says, she's in Reading right now, Gad. Probably not going to come back. And her clothes, or her clothes, and there's not that many, I'm sure. Well, she does come back. And again, I documented this and I told my boss, and the boss said the same thing. Well, she's not here. And, Gad's just talking, and you know how explosive he is because he's also got an explosive personality disorder. And I sat there and I said, well, let's see what happens with this. So pretty soon I get a phone call and it's Teresa. Teresa sits there and says, hi, Tony, I'm coming home. I says, where are you? She goes, I'm in Reading. I says, what do you mean you're coming home? She says, I'm coming home. She says, I got to get my clothes. And I says, what do you mean you have to get your clothes? And she says, well, she goes, I have to get my clothes and then I'm going back to Reading. I'm leaving Dad. And I told her on the phone, I says, where are you right now? And she says, I'm on the interstate and I'm right outside Philadelphia. We're back to Reading. She goes, why? I says, because Gad's threatened to kill you and he's going to kill you. She goes, oh, he won't kill me. He won't hurt me. I says, yeah, he will. He's going to kill you. She goes, well, I've got somebody with me. And she puts her girlfriend on the phone and goes, hi. And I says, hi. I says, take her back to Reading because Gad's got a gun. He's going to kill her. She goes, F Gad. He goes, I've got a gun in my purse. And if he pulls one out, I'm going to kill him. And I'm sitting there going like, oh my God, here we go. The wild, wild west. I said, take her back. Put her back on the phone. Teresa gets back on the phone and I sit there and I said, please go home. Go home. Or better yet, come to my office. Come to my office before you go there. And she said, why? And I says, because we got to talk. I says, let me give you a suggestion. I said, come to my office. Let's talk. I says, let's call the police. Because why? I said, because Gad is going to kill you. I says, you want to get your clothes? Let the police come with you. Get your clothes. I'll let them escort you out and drive back to Reading. No, 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 we don't have to do that. I'm just going to go to the house and get the clothes. Dad's not there right now because what Dad used to do is sell. Philadelphia got this little thing where you make pretzels and you sell them on the street corner. Literally, they're great pretzels. So Dad used to do that. And I says, no, he's going to kill you. And I must have told her that a dozen times. So she eventually says, Tony, I love you, but I'm not gonna come to the office and I'm gonna go. All right, Teresa. Uh, let me just say one last thing, okay? And she said, sure. So you know I care about you. She goes, yeah, you know I love you. She goes, yeah, of course. Great. And I appreciate that. I says, but this is going to be our last conversation. I says, you're a wonderful patient, done marvelous work, and it's going to end. She goes, what are you talking about? She goes, I'm going to be fine. I says, no, you're not going to be fine. You're going to be dead. I says, you're going to go over there. I says, and Gad is going to kill you. I says, please come to the office or go back to it. She says, no, I'm not going to do it. I says, okay. I says, well, then I want you to do me one last favor. When you get up to heaven, do me a favor. Please tell God that I love him. And, my dad died in 1988. I says, if you see him up here, just tell him I said hello. As well as my pet dog. I says, if you would do that for me, I would really appreciate it. I says, because I'm never going to see you again. Oh, Tony, you're just talking, I'll see you later. And I said, please come here. She says, no. She says, I'll see you after I pick up my clothes. So he hung up and I went to the director's office, the executive director's office, Harvey Frederick. I can mention because he's mentioned in the lawsuit. I says, Harvey, I says, we got to call the police. I says, Harvey, I says, he's got a gun. He is going to kill her. I says, can't do it. He says, he's just saying it. She wants to pick up her clothes. She's not your patient anymore. Um, it's her decision to make. I went back to my office. Furious. I started typing the notes. And I'm typing fiendishly the entire conversation, just as I related to you. I remember it word for word. And it's in the clinical notes. So, a short time after, I don't know, 15, 20 minutes after, phone rings in my office. I pick it up and it's Dad freaking out. And all I hear is, Tony, Tony, oh my God, oh my God, oh my God, oh God, calm down. What's the matter? I think she's dead. I think she's dead. Oh my God, oh my God, I think she's dead. And I said, what? I think she's dead. Somebody was crawling through the window and I shot. And I think it's her. Click. I went, Harvey. I told Harvey. And I says, what do I do now? I says, we let him go. I offered to send him to the hospital. He said no. I says, you said no. I says, I thought he was going to kill her. What do we do now? So, of course, he threw it back in my lap and told me to call homicide. So I called the homicide detectives. They wouldn't tell me anything. And I told the detective, I says, look, I'm the treating psychotherapist. I says, I need to know what happened. I need to know what to do. And the detective said, hold on just for a second. So the lead detective, the sergeant, calls me, he gets on the phone and sits there and says, I asked him, I says, I got this call from Dad. This is what happened. He's frantic. He sits there and he says that he allegedly killed somebody. And I'm just wondering if it's Teresa Hausler. And he goes, well, there was a homicide that occurred. And I went, oh, shit, quote unquote. He goes, we're going to have to come down and interview you. I said, let me put you on my executive director. Hold on. Put him on hold. Went to the exec's office, and I sat there and I says, well, he is dead. He killed her. The detectives are on the line, and they want to talk. So he gets on the phone and he starts talking to the director. And they have a time for them to come down. They come down, they do the interview. Next thing I know is the attorneys from PCHD there. They're interviewing me. They've got my chart, which was literally about this thick, seriously, with all the notes and everything. And they took that, they interviewed me, and the case went on for years. The outcome of the case, you can read in the amicus brief decision. But we were found not guilty. It went to lower courts. The lower court found us guilty, appealed it. It went all the way up the line to the Supreme Court. The Supreme Court sat here and said, I'm not sure how many judges there were, 4, 5, maybe. I'm not sure. I don't remember that part. I was never called to testify, which was nice. I really didn't want to. But one judge dissented and sat there and says I could have done more. And that's where I got angry. Because as far as I was concerned, I says, what more could I have done? I called the attorneys up. I said, what more could I have done? They informed the client. I said, I told her she was going to kill him. He was going to kill her. I tried to put Gad in the hospital. Gad wouldn't go in the hospital. I talked to my boss. I can't put him in the hospital. I'm following orders and directives. I documented everything. She went against my directives to come and see her go back home to Reading, and she dies. I says, what's up? Well, we'll give you the brief to read it after, after it comes up. Fine, you're good. They can't come after you. If anything happens, call me. Here's my card. So about a year later, I get the brief. A year later, and I read the thing, and I read the dissent, and I'm sitting there going like, this is why he dissented. And I called the attorneys up and I says, remember me? Yeah. I says, why didn't you give them my notes? But what about the notes that said this? I says, because he's saying that I didn't contact her. I said, I contacted her right there in the notes. Oh, we didn't need it because by that time we won the case and we didn't need to present any more evidence. I says, no, but you had one judge dissent. He said, don't worry about it because you're fine and clear and have a nice life. All right. End of story, end of case. You have the amicus brief. In conclusion of this video, I just want to tell you this is a real thing. This does happen. This is not made up. I hope to God you never have to go through what I went through. Years to get over it. And as you can see, here I am years later. I was in my 20s back then. I'm 63 now. Right? I remember it like it was yesterday. Right? A beautiful woman murdered by a crazed lunatic. This can happen. You don't want to play with stuff where it's a duty to warn. If you get any inkling, if you are not sure, if you question, if you think, well, I don't think he will, but once that doubt comes in your mind, get yourself to a supervisor. And if you still feel that this person needs to be 5150, even if it may cost you your job, do it. Because if you don't do it, you will never forget what happened. I have no regrets of what I did, none whatsoever. I feel totally vindicated. I don't have any nightmares. I've got no PTSD from it. But what I'm feeling are these recurring thoughts that they didn't read my notes. And Teresa could have had a good life today. Gad should have been put away. I don't know what happened to Gad because afterwards, there were a couple times where I had to appear in front of the judge. All I know is Gad was put away. I don't know if it was for life or what. So please, the 3 things: practice insurance, a good psychotherapist, right? And write. Document your notes. All right. So attached to this video will be the amicus brief. Read it. There's no assignment, but I would like your comments on this, on what you think. And especially, I want you to think about what you would do in a case like this and put it in the forum. I want to thank you. That ends my discussion on the Tarasoff case. You do have a duty to warn uh, both the intended victim, and if you cannot reach the intended victim, you do have a duty to warn a third party to protect the victim and to protect society. I would encourage you to read up on Tarasoff 1 and Tarasoff 2, review it, and discuss it. Thanks a lot. Take care. This is Dr. Tony Scuderi for InterCoast College. Bye.